Sorry.
Go ahead.
Well, I think that the big problem I see with your prescription on what to do is that the facts don't add up to what you're advocating. Like you said, because of government intrusion on healthcare, the costs are going to go up. I mean, that part I can't agree with. That you know, one thing, socialists, it's confusing because Obama is often attacked as a socialist, and Obama's health care is attacked for being socialist and big government. One thing, genuine socialists, real socialists, we don't agree with the mandate that Obama just passed that forces everyone to buy private insurance. Mm-hmm. We also have concerns about collusion between big business and big government. But what doesn't add up to about what you're saying is that you're blaming solely big government for driving up the costs of insurance, and actually it's been the free market system that's been in place for the last 20, 30 years. In the last 20, 30 years, there's been health insurance companies that have taken over, health maintenance organizations, HMOs, taken over the insurance system, and that is what has driven costs up. There's been, for the last 10, 20 years, there's been consistent complaints in the media from businesses about the rising cost of healthcare, and that wasn't from big government. I mean, big government, you know, so-called big government, they just passed their healthcare reform this year, but actually healthcare costs have been going up for at least 20 years. So, and the cause of that was these insurance companies. It used to be where they had to pay for, it's called a fee-for-service system, where you just go to the doctor provides you service and you pay them a fee. But now these insurance companies have cornered the market where people are nervous that you never know when you're going to get in an accident. And so everyone wants to have health insurance. People are willing to pay a certain premium every month so that whenever they suffer a big accident or need a big expensive surgery, they have that insurance. And so the insurance capitalists have capitalized on that, and now they've cornered the market, and they are the ones that have driven the costs up. It's not big government specifically. The way that we would, in terms of what our solution would be, there is a proven system that works much better than the for-profit system or even this system that Obama and the Democrats just created, and that's called single payer. In Canada, in Canada and Europe and even Cuba, the small island of Cuba has a better healthcare system than what we have here in the United States. And they have what's called a single payer system, where the government is the single agency that pays for everyone's health care, and that is actually proven to be cheaper. Take Canada, for example. They spend half what the United States spends per capita, and yet they cover everyone. They don't have 47, they don't have a sixth of their population that doesn't have health care coverage. The whole country has health care coverage, and yet they spend half what we spend. France spends less than what we spend, yet they cover everyone. And so instead of having 1,300 different a patchwork of insurance companies all competing against one another, that's one of the funny things the Tea Party complains about, big government and bureaucracy and red tape. It's actually these insurance companies are huge red tape. I mean, every time I go to the doctor, you have to call and try to convince the insurance companies to pay they always try and say, well, they charge you every month a certain premium, and then they don't want to pay your bills. They say, well, we only cover this medicine, but not that medicine. We cover this procedure, not that procedure. It's a huge red tape bureaucracy. 1 out of every $3 dollars spent in this country on healthcare is spent on administration, and that's CEO, executive salaries, but it's also this huge web of insurance companies that haggle over bills. Many hospitals have. They spend one in three. They have more billing clerks than nurses, actually. $1 in $3 in this country is spent on administration. So it's proven to work much better. The World Health Organization, I'll finish on this, the World Health Organization did a survey of all of the industrialized countries in the world, and although the United States is richest, we came in 37th after Slovenia in terms of our health care. If you have a single payer system, it's proven to be cheaper, universal coverage, better quality care, better preventative care. It's better on longevity, lifespan, and also infant mortality. So hands down, a socialized system is better.